Muy buenos días. Me llamo Plesh y es un honor estar con ustedes hoy representando los servicios de intérpretes en la región de Wisconsin. Llevo más de 17 años trabajando en SSM Health. Bueno, ahí termino con el español, pero primero tengo una pregunta para ustedes. ¿Cuántos aquí me entendieron? Sí, conocí a Oscar anoche. ¿Alguien más? Muy pocos. I've just asked how many of you in the room could understand my introduction. For the rest of you, I will back up and start again. Good morning. I am Plesh, and it is an honor for me to be with you today representing interpreter services in the Wisconsin region. I've worked at SSM Health for more than 17 years. I started my career as a Spanish interpreter, and in my current role, managing interpreter services across Wisconsin, my best days are still those in which I get to interact with patients. Take the confusion that many of you just felt and imagine what it feels like to the thousands of patients we serve at SSM Health each year who cannot speak or understand English well enough to understand their care or to effectively make decisions about it. My job calls upon me to ensure that our patients have access to qualified medical interpreters, to help bridge gaps in understanding, and to be fully present to bring peace through communication when some of the most vulnerable individuals in our communities are at their most vulnerable. Consider the deaf patient our American Sign Language interpreter in Wisconsin, Adele Martin Boyle, recently worked with. After years of struggling in another health system to communicate with his doctor by writing notes, an ASL interpreter was scheduled for his visits. Over the course of several weeks, in which numerous tests were done, Adele interpreted into American Sign Language what it means to have high cholesterol, prediabetes, and she helped to explain the importance of lifestyle changes. Imagine the provider's delight when several months later, the patient had lost more than 40 pounds. He was exercising daily, and most of his labs had returned to normal. Now imagine the interpreter's delight when the patient took just a moment to thank her. With you interpreting, he said to Adele, it was the first time I really understood my doctor, and now I know what to do in order to be healthy. It is this and stories just like it that I reflected upon as I considered this year's conference theme of presence. The medical interpreters that I have the privilege of leading in Wisconsin are present with patients during every step of their journey, within and across our entities, from registration to the emergency department, with lab and imaging, and often billing and insurance questions along the way, or from places like labor and delivery to the postpartum unit, sometimes the NICU, and the pediatrician's office. From minor but essential details, like helping to order a meal or how to navigate the parking ramp, to pivotal conversations, like the discussion of treatment options or end-of-life decision-making. We are there, concentrating, listening intently, and helping to forge the connections that are so vital to the personal and present care at the heart of our mission. The importance of our work goes far beyond the various regulatory and legal requirements in place for interpreter services. Instead, and boy, Sister Mary Jean, I hope I get this right, instead I think about Sister Mary Jean's words when she spoke to us years ago on a visit to Wisconsin. She spoke to us that day about a sacred trust, and I jotted her words down as she spoke them. The Post-it note to this day still hangs on my office wall. We must, she said, care for people in a way that touches their souls, so that everyone, including ourselves, is in some way healed. She had so eloquently put into words what I have always felt about interpreting, but had never quite been able to express. Over the years, I have been honored and humbled by this sacred trust that our patients, as well as our providers and staff, so willingly give. And I have been awed at how this work, even when it's at its most difficult, heals me. I have been the voice of many during some of life's most wonderful and painful moments. I have witnessed and been part of the joy that comes with new life as it enters the world. And I have observed and spoken every word of the pain of a loss too unimaginable to speak. And sometimes, I think maybe most times, the language barrier that we face with our patients is actually the easy piece. I've heard culture defined as the space between the words. To me, presence might mean this very same thing, the space between the words. It is in this wordless space where we seek to understand the patients and the families that we serve and give them, as unique individuals with unique needs, the care that they need in order to be healed. I've got an example to share. I recall interpreting in the emergency department for a woman who had been alone in a minor car accident, a fender bender, really. Her family met her in the ED, and they came in with her infant child. Her very observant nurse immediately recognized that her child was hungry and asked her whether or not she was nursing. The patient confirmed that she was, but she seemed reluctant to feed her baby when her nurse told her that it would be safe to proceed. It was in that awkward moment that I recognized the space between the words, knowing that in some Spanish-speaking cultures, there's a concept called susto. So susto, when translated literally, might mean fright or scare. Also can be the idea that a profound shock, something as simple as learning very bad news, or, as in this case, the shock of being in a car accident, can physically affect your health. As transparently as possible, I confirmed my suspicion with the patient and shared this with the nurse. The patient went on to explain that she was worried that the car accident had affected her milk, and she feared that nursing her child would make her baby sick. The nurse quickly brought in a bottle of formula, and when the physician came in, he sat down and he listened. He asked the patient about her beliefs and found a way to honor her concerns. Together, they decided if she expressed and discarded her milk one time, all new milk that her body would make would be safe for her baby. The physician, of course, could have told her, don't worry about it, it'll be fine. He could have told her he didn't understand susto or think it was real, or think that something like susto could make her milk, and by extension, her baby sick. But instead, he listened and found a way to give this patient the care that she needed. That day, that moment, Dr. Kyle Martin was present. He healed his patient by honoring her culture and her values and truly delivered upon our mission of providing exceptional care. And that afternoon, the care that he gave through me healed me, and it gave me one more reason to love what I do. I mentioned at the beginning of my comments that I've worked at SSM Health for more than 17 years. For those of you doing the math out there, bear with me, the obvious joke is coming. I started when I was about 12. Truly looking back, this was my very first job out of college, and I was young. I have in so many ways grown up here. I'm grateful to SSM Health for giving me a career that has grown with me and for giving me so much to love. I am proud to work where our mission and values align with who I am and with what I believe, and where presencia, presence, in whatever language you say it, and whatever language our patients say it, truly is at the heart of everything we do. Thank you.